products 31,051,000 from KEMSA to be distributed to 113 edge facilities across 5 sub-counties. We expect the health workers who use these commodities rationally and transparently. Our county has been grappling with the shortage of commodities, and this undermines our capacity to provide quality health services. We are also developing an online application that will improve transparency in management of commodities. This will enable wananchi to know how drugs are available in our facilities. This one will work alongside the current measures being initiated by the national government on commodity management. My government has also established an health products and technology unit to coordinate the management of essential drugs across the county in order to ensure rational drug use at all levels. My government has and will allocate sufficient resources to ensure facilities have adequate commodities. The county government of Nyamira appreciates collaboration and the partnership with the KEMSA since the of devolution. We however encourage KEMSA to improve their capacity in supplying medical commodities, as currently we are served. This negatively is affecting the government's agenda on universal health and the general health service provision. When budget allows, we will recruit more pharmaceutical staff, and we recruited a few, we'll add more, to oversee management of these drugs in the facilities where currently there are none. Finally, my county government of Nyamira is working with the national government in preparedness and emergency response over El Nino phenomenon to mitigate against flooding and effect-borne diseases. As a county, we are prepared for emergency, mediation, and the procurement of chemicals for waterborne diseases. Asanteni sana.